So dear students, now we are going to begin with the muscles of lower limb. So for the first compartment under muscles of lower limb is thigh. So in thigh we are going to see the anterior compartment today. So the anterior compartment muscles are called as extensor compartment muscles because anterior compartment helps in the extension of the knee joint. So they are called as extensor compartment of thigh. And it is bounded laterally by the lateral intermuscular septum and medially by medial intermuscular septum. Anterior compartment, apart from the muscles, we also have got nerve of the anterior compartment called as femoral nerve, and the artery of anterior compartment of thigh is the femoral artery. So now this session is on muscles of the anterior compartment. So the muscles are quadriceps femoris. So we are going to discuss quadriceps femoris, articularis 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞, Sartorius, which is also an superficial most muscle, and TFL, tensor fascia lata. So these are the muscles which we are going to discuss now. So starting with quadriceps femoris. So the muscle is so named because it consists of four heads. Ceps means heads, quadri means four. So it has got four parts. So quadriceps has got four parts called as rectus femoris. So parts I am writing. Rectus femoris. Then vastus. Vasti muscles are three heads. So vastus lateralis, vastus medialis, vastus intermedius. All these heads are supplied by the femoral nerve, and it forms the most of the bulk of the anterior aspect of the thigh, and it is the most powerful extensor of the knee joint. And all the parts of quadriceps femoris cross only one joint, that is the knee joint, except with the rectus femoris muscle. So rectus femoris is further having two heads, and it crosses two joints, that is the hip joint as well as the knee joint. So let's see the origin, insertion, nerve supply of these various parts. So here is the rectus femoris. Rectus femoris has got two heads, straight head and reflected head. So straight head, it gets origin from anterior inferior iliac spine. Inferior iliac spine. This one is the anterior superior iliac spine, ASIS. The one below is the anterior inferior iliac spine. So anterior inferior iliac spine also gives attachment to a ligament called as iliofemoral ligament of hip joint. So it gets origin from anterior inferior iliac spine. One more head is the reflected head. Reflected head, it gets origin just above the acetabulum, inferior to the inferior gluteal line. So the area above acetabulum, from the lateral surface of the ilium. Both the heads, they converge and they get inserted along with the other tendons of the quadriceps femoris into patella. So the patella is a sesamoid bone which develops within the tendon of quadriceps femoris. So both the heads, they meet at an acute angle and form a fusiform belly, and which occupies the front of the thigh. So as soon as you remove the skin, superficial and deep fascia, you are going to see in the middle rectus femoris. So in the lower 1/3 of the thigh, the muscle ends as a flat tendon, and where it descends vertically to get inserted into base of patella. Further, we can see this from the apex of patella. So patella is not shown because it is within the tendon. So here it is like this. So from the apex, this one is the ligamentum patellae. So ligamentum patellae is part of the tendon of quadriceps femoris. So action of rectus femoris, it extends the knee joint because it crosses the knee along with the other quadriceps, and also it helps in the flexion of the hip joint. So it helps flexes the hip and extends knee. So the rectus femoris is also called as kicking muscle because it extends the knee and flexes the hip. So the actions required during kicking. So the next head of the quadriceps femoris is vastus lateralis. This is vastus lateralis muscle. So remember, all the vasti, they get origin from the femur and they all get inserted into the patella. So it takes a linear and aponeurotic origin from upper part of the intertrochanteric line. So this is the upper part of the intertrochanteric line, it gets origin, and the anterior and inferior borders of the greater trochanter also, and continues with posterior origin. So posteriorly the femur has got a rough part which is called as linea aspera. So it gets origin from the upper half of the linea aspera and also partly from lateral intermuscular septum. So this muscle gets inserted by a broad aponeurosis into the tendon of rectus femoris. So first it converges into the tendon of rectus femoris and finally gets inserted into the base of patella and also on the lateral side of patella. So vastus lateralis, so all the quadriceps femoris, don't forget to remember that it is supplied by femoral nerve. So it is by the posterior division of femoral nerve. And as it crosses only the knee joint, its action is mainly the extension of the knee joint. So we can see the patella clearly here. So the next is vastus medialis. This is vastus medialis muscle. It covers the medial surface of the shaft of the femur and it gets origin like a linear origin from the lower part of the intertrochanteric. So this is the lower part of the intertrochanteric line and continues along the spiral line into the medial lip of the linea aspera. So vastus lateralis is from the lateral lip of the linea aspera and vastus medialis is from the medial lip of the linea aspera. It extends till the supracondylar line. So posteriorly till the supracondylar line. It also arises from medial intermuscular septum and it gets inserted into the medial side base of patella and medial side of patella. So that is the insertion of vastus medialis muscle and it replaces the capsule on the anteromedial aspect of the knee joint and it is supplied by femoral nerve. So it is supplied by the nerve to vastus medialis, which is the thickest muscular branch of posterior division of femoral nerve. And as we know, it is not crossing the hip, it is crossing only the knee joint. So it helps in the extension of the knee joint. The lower fibers of the vastus medialis are far more down and the medial border of the patella than those of the vastus lateralis on the lateral side. So therefore, they prevent the natural tendency of patella to dislocate laterally during the extension of the knee joint. So the role of vastus medialis is indispensable for the stability of patella. So next is the vastus intermedius. Vastus intermedius, it arises from the anterior and lateral aspect of the upper 3/4 of the shaft of the femur. So you can see here from here to here, upper 3/4 of the shaft of the femur, it gets origin. So this is vastus intermedius. And insertion, as like others you can see properly, it inserts to the base of patella. And insertion into the base of patella deep to the tendon of rectus. So you can see the vastus intermedius in a dissected cadaver only when you remove the rectus femoris. So when you lift the rectus femoris, the muscle which is closely in contact with the anterior surface of the femur is vastus intermedius muscle. It is also supplied by the posterior division of femoral nerve and we can see it crosses only the knee, so it helps in the extension of the knee joint. So here we can label now the rectus femoris is removed here. So you can identify the muscles. This is vastus medialis. Here is the vastus lateralis and this is vastus intermedius. Rectus femoris is removed to expose the vastus intermedius muscle. So all the vasti are seen in this picture. And one more muscle which is present in the anterior compartment is 𝗤𝐻𝐵𝐻𝐿. 𝗤𝐻𝐵𝐻𝐿, it is a small muscle and it consists of 3 to 4 muscular slips and which are considered to be detached part of vastus intermedius itself. So if you see its origin, it arises from the anterior surface of the lower part of the shaft of femur, few centimeters above the patellar articulation. So somewhere here it gets origin beneath the vastus intermedius muscle, and it gets inserted into the synovial membrane of knee joint. So upper part of the synovial membrane of knee joint, it gets inserted and it is supplied by the same nerve which supplies vastus intermedius. So the twig which supplies the vastus intermedius, the same nerve twig supplies articularis genu. So that is this muscle. Genu means the knee joint. So next we would discuss about Sartorius. Sartorius is the longest muscle in the body and it crosses in front of the thigh obliquely. It is most superficial muscle. So as soon as you remove the skin, superficial fascia and deep fascia, the first muscle which is seen running obliquely in front of the thigh is Sartorius muscle. It is from lateral to the medial side. Such a long, beautiful, slender muscle it is. And it arises from ASIS. You can see here, anterior superior iliac spine. Iliac spine, it gets origin. Insertion, the muscle spirals obliquely across the thigh from the lateral to the medial side to reach the posterior aspect medial condyle of the femur. So it reaches and it inserts where? It inserts into the upper part of the medial surface of the tibia. So this is the medial surface. So you can see here it gets inserted. Soft tibia along with 2 more muscles called as gracilis from the medial compartment and semitendinosus from the posterior compartment. So 3 muscles insert at a common place, that is the upper medial surface of the tibia, and 3 muscles together called as 𝐼𝐻𝐵𝐻𝐿 muscle. So Sartorius along with semitendinosus and gracilis called as what? I am writing here 𝐼𝐻𝐵𝐻𝐿 muscle, because they are from 3 different compartments of the thigh and insert to the medial, upper medial aspect of the tibia, stabilizing the pelvis, because all the 3 muscles get origin from the hip bone. So that is about the Sartorius. So the nerve supply of the Sartorius, it is supplied by anterior division of femoral nerve. So here is the nerve supply, anterior division of, so I am writing N for nerve supply. And then actions, as it crosses the hip and the knee, it flexes both the hip and the knee joint, and it also helps in adduction and rotation of the thigh. So it helps in the adduction of the thigh and lateral rotation. So rotates the thigh laterally to bring the lower limb into the sitting posture. So especially this is the posture used by tailors while stitching the clothes. So Sartorius is called as tailor's muscle. It is called as a tailor's muscle. It is the posture which is adopted by the tailor, adopted by Indian Hindus also. So during meal, so these that is the posture for tailors. So it is called as tailor's muscle. So another muscle which is partly into the anterior compartment. So small part of it is present in the upper part of the anterior compartment of the thigh here. This is called as psoas major muscle. We can see the psoas major muscle. It gets origin from the lumbar vertebra and it is inserted to the lesser trochanter of femur. And it is a powerful flexor of the hip joint. So that is the main action of psoas major muscle. Along with the psoas major, there is one more muscle called as iliacus. This is the iliacus muscle, which is also seen in the floor of the femoral triangle. Anterior upper medial 1/3 of the thigh is formed by the femoral triangle. So iliacus and psoas major forms the floor of the femoral triangle. We can see the tendon of the iliacus again getting inserted to the lesser trochanter. And you can see the origin of it here, that is from the iliac fossa, which is present on the medial side of the ilium. And psoas major and iliacus both are supplied by the femoral nerve, which is the nerve of the anterior compartment. There is one more muscle called as tensor fascia lata. Tensor fascia lata is a short thick muscle which lies at the junction of the gluteal region and upper part of the thigh. So some people consider it as under gluteal region also, tensor fascia lata, and it gets origin from the iliac crest here. So this is how it gets origin, and it gets inserted to a tract which is present on the lateral side of the thigh. This tract is called as iliotibial tract. Iliotibial tract is the modification of the deep fascia which attaches to the lateral condyle of the tibia below. So tensor fascia lata gets inserted to the iliotibial tract. So along with the tensor fascia lata, there is one more muscle which inserts into the iliotibial tract, is gluteus maximus muscle. So this is the muscle which is in the junction of gluteal region and upper part of the front of the thigh. And this is a gluteal muscle because it is related to the gluteal region. So tensor fascia lata here, TFL we can call, or tensor fascia lata, because it inserts into the iliotibial tract, which is otherwise called fascia lata, that is nothing but deep fascia of the thigh. It increases the tension of the iliotibial tract when it contracts. So it is tensor fascia lata. So this is actually a part of gluteal muscle. So it is supplied by superior gluteal nerve. Superior gluteal nerve is the nerve supplied to tensor fascia lata, and it helps in the abduction of the hip joint because it is present on the laterally, and it extends the position of the knee joint through the iliotibial tract. So as it is inserted to this iliotibial tract, it stabilizes the knee joint in extended position. So it maintains the extended position of the knee joint through iliotibial tract. But developmentally it is a part of gluteal region, a muscle of gluteal region which has migrated on the lateral aspect of the thigh. So during the course of evolution, it retains its nerve supply. So though we say it is under lateral and anterior compartment, some books give tensor fascia lata as a part of gluteal muscle, and sometimes some books may give as a part of anterior compartment muscle because it is somewhere present in the intermediate level. So the nerve supply of it is the superior gluteal nerve. So this completes the muscles in the anterior compartment of thigh.